view of the canyon, the sound of the sword, it's a bunch of beaches, your wife and shout, while you wait for appointments, as you walk through the park.
Hello class, and welcome to today's lecture, Human Sexual Anatomy. Specifically, this first video you guys are going to be witnessing is going to be male human sexual anatomy, and then we're going to have another video over female human sexual anatomy. One thing I do want to point out is that from this point forward, we are going to be getting a little bit more in depth into the detail of what it is to talk about human sexuality and sexology. And so I really just want to warn everyone that viewer discretion is advised. There will be content related to human sexuality and behavior. Given this, we are going to be looking at images, movies, and discussions that may be more sexually explicit in nature. So I just kind of want to give a warning to everyone out there that there may be some images here that some people might not be prepared for, not be ready for, and so I just kind of want to warn you that there are real images here of human anatomy for learning purposes for this lecture. So kind of be prepared for that to happen. But we're definitely going to be getting into this, and this is kind of a warning from here on out in the semester that we're really going to be talking more in depth about this stuff, so we need to be prepared for that in the material. One of the biggest things is a lot of people are probably looking at me and asking, why are we learning human anatomy in a psychology of human sexuality course? Well, the biggest reason for that is there's a psychological importance to knowing your anatomy. As we will get into with each of these lectures, we'll get into more of the specifics of the psychological importance of human anatomy and how that can affect individuals. But really a lack of knowledge can really a lack of knowledge can prevent the recognition of health threats. So if you don't know what your penis or vagina, vulva, those parts of our body are supposed to look like, if we don't know what ours normally looks like, then how can we tell when there's something abnormal, such as a sexually transmitted disease or illness, or something like maybe a cancer starting to form? If you don't know what you got and you don't know what it's supposed to look like, how are you supposed to know when there's a change that occurs? Also, not knowing what really human sexual anatomy is about and kind of the limitations in that and the spectrum of it can really create body image issues for people and even anxiety with regards to sexual performance, sex, just their body image in general, and getting caught up in this idea of not knowing what it's supposed to be, so being freaked out or worried about that theirs isn't right or normal. And the other thing is that not knowing about your physical anatomy can generate sexual dysfunction and relationship problems. And just knowing what's down there, what are you supposed to be doing, what are the different parts and functions of each of it, can be really difficult and create problems within marriages and relationships. Also, teaching anatomy is a very common component of sex therapy. Again, you've got to know what's down there to be able to know what to do with it, in a sense. One thing that I always like to add is that the more comfortable you are talking about sex, talking about your body parts, understanding all of that, the more comfortable you're going to be in the act of. And so knowing your human anatomy, knowing what things are supposed to look like, what things aren't supposed to look like, can give you an understanding of yourself and your partner and be able to make the process of actually engaging in some sort of a sexuality a little bit more pleasurable, because you're not caught up in this world of anxiety or body image issues. You're able to embrace each other. It's kind of if you're not able to talk about sex or the body parts involved in sex, it's one of those ideas that maybe you shouldn't be having it until you're more comfortable with that. That is kind of my own caveat just to put out there. But it is one of those things, the more comfortable you are with it, the more that sexuality, sexual behaviors can be a little bit more comfortable and not such a taboo subject. So really knowing your body can really help you in this area of life. And I always like to put some caveats before proceeding. When we're talking about sexual anatomy and gender identity in this class, they are distinct. But in this lecture, we're going to be talking about the very basics of male human anatomy and female human anatomy. We're not really going to be talking about transsexual persons or those who identify as transgender, who are transitioning in their gender. And we also like to point out that not everyone has a penis or a vulva. There are people who are intersect, who are born with both characteristics or characteristics reminiscent of both male and female, which is something that we also need to be aware of. The other thing is I always like to bring up in this part of the lecture is that a lot of people are like, but your biology, your genetics dictate this. So the reality is we have a lot of men and women out there who have a variation of genetics when it comes to their presentation. So there are men out there who with Klinefelter syndrome that actually have more than one X chromosome. And they're either presented with an XXY, XXXY. Most of these men don't really necessarily know that they have this until later on, but there's different characteristics in which develop during this, but it doesn't necessarily mean that they're not biologically male, even though they have two X chromosomes, which is technically the biological female, but they also have this Y component. We've also had it where people are born with only one sex chromosome, and so that is a very different type of genetic presentation that we can see. But genetics, your biology doesn't dictate your gender or your expression of your natural anatomy and body. It's a combination of things. So that's something we always like to put out there, is that there's always differences, and that we are talking in the very basics of terms when we're talking about anatomy, and we're not necessarily getting caught in the nuances at this moment. But I also want to put out there that we acknowledge those nuances exist, and so we're not trying to downplay them. And we got this little funny meme that says, "You're a man," and he just said, "Did you assume my gender?" Just because someone may look masculine or manly does not mean that they identify that way. And that's the idea behind here. You may have the sexual anatomy of one, but identify as the other. And so just because you have the sexual anatomy, the bits, doesn't mean that's how you identify and recognize yourself. All right, now to get really into it. We're going to be talking about the male sexual anatomy. And as you can see here, there are a lot of parts and pieces to the male sexual anatomy. One thing I always like to talk about in this lecture is that the history of the male sexual anatomy has really had a positive and negative features to it. We used to have the Romans actually wear tiny replicas of penises around their, as a necklace, and it was fascia. So literally when we're saying something's fascinating, we're literally saying something along the lines of how interesting their penis is, or how fascinating a penis is. The intrigue of another penis is the way the book defines it. So we've gone through times and periods like that where we used to wear them as symbols and we're proud of them, to where it was depicted in art and actually torn off. So there's statues that are missing penises or penile genitalia in any form because of the way society was viewing it then. It was viewed as vulgar. And currently in our society, we really have this vulgar view of a penis or phallic symbols, to the point where it's not really included in daytime TV, it's not really included in mainstream media, except for very few instances. So I don't know if any of you guys ever watched the movie Watchmen, but this is one of the first major main time movies in which we actually showed the male anatomy, and it wasn't necessarily rated as pornographic or NC-17, it was rated R. But they went through a lot of trouble to actually get that to do, and they had made many renditions of Dr. Manhattan's penis during the production to be able to get one that was going to be approved. Even then, we had an outrage. Some people didn't believe that it was necessary. We had other people who believed that what they did was an exaggeration of what the original drawing and the original character was. So it's kind of interesting. Some people were excited that we were able to show a penis in mainstream media. Other people were upset that we were showing a penis, and other people were unhappy because the penis wasn't representative of what Dr. Manhattan had, according to the mythology and lore set out in the comic books. So it's very interesting, the reactions that we get to the male human anatomy. And given this, in our current state, we're at more of this more vulgar side of it, so we really don't see the male's human sexuality very often, or sexual anatomy, and it's not even really discussed very often in society today. But getting into it, we have the male sexual anatomy. So we have the external anatomy of the male genital region, and the penis consists of three parts. So we have the internal root, the external shaft, and then the glands, or the head, right? So the meatus is actually the urethral opening. So that is actually the technical term for the opening of the urethra. And it's actually at the tip of the glands, or at the head of the penis. Another name for the glands of a penis is also commonly referred to as the head. There is a cornea on the head of the penis, which is basically this distinctive ridge that is encircling the glands. That kind of gives it its characteristic shape, as some people have described it as having like a mushroom head. This is kind of responsible for that creation of that and that distinct look. It is believed somewhat that there may be an evolutionary adaptation for having this distinctive ridge. They've done some studies that shown that if another man has sex with a woman who's already been inseminated, so she already has semen within her vaginal canal, that this cornea of the ridge can actually remove or pull the semen out, which is an evolutionary genetic characteristic, and you're able to better compete for pregnancy. So the idea behind it is that the penis, your penis would be able to remove the seminal fluid from another man, which means when you ejaculate, yours would be in there and more readily available to reach the egg, the ovaries, to be able to do fertilization. Though this hasn't really been fully proven, it is one idea out there. There's also other ideas out there about why it is designed or like shaped the way it is, and there's different functional properties for this. So kind of getting a little closer look and talking about those actual human pictures. So up here on the right, we have a circumcised penis. And right here we have, on the left, we have an uncircumcised penis. The way you can tell the difference is the skin here and the distinctiveness of the ridge. Without the skin, it actually makes that distinctive ridge look more distinct, actually. And so that's what we want to talk about is like the cornea is this ridge here. And we also have a cornea around this one. And then this is the meatus, which is where the urethra opening is. And as we can see here, the urethra opening would be here. This is the glans, or the head of the penis. And then we also can see here as an uncircumcised, he has foreskin that's been pulled back due to his erection. So we have the shaft of the penis here, which we're going to be going and talking about a little bit more. The root of the penis, which is more of an internal structure. And then we also have the scrotum, which contain the testes, which we'll go into a little bit as well. So one thing that we always like to talk about is circumcision. So in the natural male anatomy, we are born with a foreskin, or a prepuce, which is the foreskin, another name for the foreskin, which actually covers the entire glans of the penis. And when a person becomes sexually aroused, what happens is the skin folds or slides back around the head of the penis, exposing it to engage in that sexual act, right? So circumcision is controversial. It doesn't seem controversial in our country because it's something that's been done for a very long time and it's kind of just globally accepted. Though that is changing, we have an increase in people choosing not to be circumcised or choosing not to perform circumcision on babies and giving the person their choice, which is the complete removal of the foreskin so that you expose the glans of the penis. Part of the reason why it is suggested to be doing this is because of cleanliness reasons, which we'll go into a little bit more later on in the lecture. But having the foreskin over the penis head, you have to take special care to make sure you're cleaning and pulling the foreskin back while cleaning. And also at the same time, making sure that you're not catching any extra fluid or liquid in the foreskin after bathing as well for that cleanliness. Aspect. So you can see here a uncircumcised penis and a circumcised penis. One of the biggest differences, as we kind of saw in that last picture, is the exposure of the head. This is always exposed. The foreskin does cover this at least partially. Went backwards. And that's full circumcision. There are some countries and some regions and cultures who perform a super incision, which is basically instead of removing the entire skin around the head, what you do is you do a vertical cut, a lengthwise cut along the foreskin. Again, they sew it together so that there's no bleeding and that it heals correctly. But then this exposes and loosens the skin around the head of the penis and allows it to be more easily revealed and not necessarily always during sexual arousal. Super incisions and circumcisions can be done at any point. A lot of times people get them done when they are babies or infants. But you can also do them later in life. So some people end up going through these procedures because maybe their foreskin is too tight and is causing pain during erections or sexual activity. And so they'll create an incision or do a circumcision to be able to loosen that around there to create an increased comfort and ability of use and functionality. So people, like we know, we always have the idea of penis size. Larger is better. Larger may not be better. There's always something that can be preoccupied with, or people can be preoccupied with. And this is one of those states where if you know human anatomy, you can remove some of that anxiety of what's normal, what's not normal. Do I have a large penis? Do I have a small penis? What do I do with knowing how big my penis is? Does it even matter how big my penis is? And so penile appearance and size varies widely. widely, widely, widely. The average non-erect penis is 3.6 inches long, while the average erect penis is around 5.2 inches long. There's been other studies showing that it's around 6 inches long. So we're looking at the average size of a penis being between 5.2 to 6 inches long in length when erect, and then about 3.6 inches, almost 4 inches, while non-erect. So kind of as we go forward, we're going to be talking about the scrotum now. Now, the scrotum is a loose patch of skin that hangs beneath the penis and houses the testes. As we can see here, there's 3 different images we have here. We kind of have like the testes in the scrotum, where we can kind of just see. We have one layer removed where we're kind of looking at the muscles inside the testes, or inside the scrotum. And then we're also looking now at where the testes, the vas deferens, somatic cords, lymphatic vessels are within there. So it kind of gives you a outside-in view of what the scrotum has in the testes. The scrotum is generally sparsely covered in pubic hair. Some people have more, some people have less. Again, size and shape can vary in appearance greatly. One thing that I always like to point out people is we've seen through research on average that the left testicle for most men hangs slightly lower. And so the fact if your testicles are not hanging at the exact same height, they're not hanging buddies together, one's a little lower than the other, that's okay. That's normal. That's what most people we see have. And the reason this is because of the somatic cords, the cords connected to the vas deferens, they're longer on the left side than they are the right side, which allows it to hang a little bit further. Scrotums, just like most body parts, are not perfectly symmetrical, and your scrotum to your penis may not seem symmetrical or may not seem balanced. There can be different sizes. Someone can have a very large penis and a very small scrotum, and vice versa. So this variation in size not just happens with the penis, but with the scrotum and in combination between the two. So that is always something to be aware of as well, is that there's different size penises, there's different size scrotums, and there's different size of penis and scrotum combinations. So this next slide is going to contain an actual picture of a human scrotum. One of the things I kind of wanted to point out was the book talked about like the changing in shape and size. And so this is just a demonstration of, this is more of a scrotum at maybe like room temperature, where maybe this is someone being exposed to a little bit of cold. And you'll see actual skin tightening around the scrotum, and that's really to protect those testes, to really keep their environment the way it's supposed to be. We'll kind of get into that a little bit more at the end of lecture, but kind of just wanted to show this, that kind of sparsely covered in hair, it can kind of change its shape and size throughout the day. And even we can kind of see here on the left side, it's hanging slightly lower here than it is on the right. So again, that evidence that that's kind of a natural phenomenon that does happen. When we're looking at the internal anatomy of the male anatomy, we're talking about the penis here. We're actually talking about those internal structures. We kind of covered it first. We have 3 cylinders that runs the length of the penis, so down the length and the shaft of the penis. 2 of them are considered carnivorous bodies, and 1 is a spongy body, which encircles the urethra and then actually forms those glands. So on the top of the penis, you have the spongy body that kind of circles around the urethra, and then at the end, the spongy body goes and forms and develops the glands, or the head of the penis as well. All of these contain erectile tissue, which means that they are going to respond to an increase in blood flow. The way that the penis becomes erect is actually it traps blood inside the penis. Doesn't completely trap it, it just limits the outflow compared to the inflow. And so all 3 of these, the 2 carnivorous bodies and the spongy body, will end up become engorged with blood when someone is aroused, and that's what creates an erect penis and the change in the size and the shape during that time. There's also muscles at the base of the penis that assist in ejaculation, and these can be strengthened during Kegel exercises. So a lot of times people hear Kegel exercises and they think of women. Men can do the same thing, and actually it can change the way you ejaculate when you do orgasm. It can change the ejaculation trajectory in different ways. So one idea about this is if you want to try this or you want to practice these Kegel exercises, it is the same muscles you use to stop urinating midstream. So the next time you're going to the bathroom, if you're kind of wanting to see what these Kegel muscles are, go to the bathroom, stop yourself midstream, and just take note. What are those muscles? Those are those Kegel muscles. Those are the muscles at the base of the penis. And for men, what this can do is it actually has been shown to be able to reduce premature ejaculation, as well as change the way you ejaculate. So when we talk about ejaculation, there is this idea that's commonly talked about in male groups, or can be talked about in male groups, of being a shooter or a dripper. Well, one of the ideas behind this is Kegel exercises can actually increase the force of your ejaculation, which then can kind of transfer you from being a dripper to someone who's more of a shooter per se. So that's one of those ideas behind the Kegel exercises. It can also just strengthen those muscles in general. So if you're having problems performing sexually, that can be a benefit as well. So those Kegel exercises are not just for women, they are for men, and they can be very beneficial in helping with like erectile dysfunction, as well as just general self-perception and health, depending on ejaculation and different aspects like that. So now we're kind of moving into the internal anatomy as well. We're talking inside the scrotum now. And we have two testes, generally, inside the scrotum, right? Each of the testes has two functions. One of the big functions is to produce those sex hormones. They are a major producer of testosterone. There we go. Lost it for a second. The other part of it is these are the warehouses of sperm production, or as the technical name is, spermatogenesis. So spermatogenesis is the production of sperm, and it's usually around a 28 to 30-day cycle. We're not really going to cover that in class, in this class, but it does, if you want more information about that, there is a process out there, and it's very similar in a sense to the development, follows the same path timeline as like a lot of times is like periods and menstruation cycles. So what we can see here is we have the actual testes here in the middle. What we see here, this little crescent moon-shaped guy, is the epididymis. And what this is it's where the sperm maturation actually occurs, and it gets stored after the creation happens within the testes. And then what we're going to do is we're going to move into, when we leave the epididymis, we do it through the vas deferens, which is what's going to deliver the sperm to the ejaculatory duct, which we will get there in a minute. So inside the testes, we have the semi-inferius tubules, which they actually manufacture the sperm. So that's these little guys here that we're kind of seeing, these little tubule guys kind of hanging out. So these are where the actual sperm is being made. And then we have the interstitial cells where they produce the sex hormones. And those are going to be your cells in between. That create the hormones that our bodies react to, at least as men, for puberty. Once produced, sperm mature in the epididymis. So once they've gone through spermatogenesis, they will actually take their next step, and that's when they'll move into the body of the epididymis, which is where they'll, in a sense, age until they are the appropriate age to be released for fertilization, and are eventually carried away by the vas deferens. So those are the tubules that kind of go along the spermatic cords that actually deliver the sperm that was created into the ejaculatory duct to be able to be ejaculated and ideally fertilized if that's the process that you're going under. The cremaster muscles move around the testes, move the testes closer and further away from the body to regulate temperature for optimal production of sperm. So that is actually why we have a scrotum. So the whole idea here, when I was kind of looking at the changes here, the reason the scrotum changes in shape and size is part of that muscles are pulling up on those testes and pulling them closer to the body. We do that in periods when our body gets cold because the temperature that spermatogenesis is really ideal for is about 35 degrees Celsius, which is about 2 degrees Celsius lower than the human body. So that's part of the reason why they do hang out and away from the human body, is to maintain that temperature. But when they become threatened by cold or heat, they change, either going cold, they go closer to the body, or heat, they try and expand further away from the body to maintain that temperature, which is ideal for spermatogenesis. I haven't talked to you. I take it you haven't had sex for a while. Just looking at this funny, it's normal sperm, your sperm. So sperm that's kind of on, like, mutated, right? This is kind of making fun of the amphibians and how they start off as little tadpoles and then become frogs, right? So it's the idea that you've really matured. You haven't ejaculated and gotten rid of that sperm. Semen is another part of the male human sexual reproduction and sexual anatomy. And this is with the vas deferens, which are the tubes that we just showed that are on the back side of the epididymis that carry the sperm up to the ejaculatory duct. This is where the sperm is combined with other secretions from the seminal vesicles and prostate gland to create semen, right? So secretions assist in the sperm motility and nutrition. So without the semen, which is the clear fluid around it that combines with the sperm, you would not really have very motile sperm, and sperm may not survive very long or really become activated to start searching, in a sense, for the egg, which is their purpose in design. So prior to the release of the semen, we have the Copper's glands release a pre-ejaculate that alkalizes the urethra. So the thing about sperm is they don't really like an acidic environment, and our urethra is actually sort of acidic. And so this alkalizes it, reduces or increases the pH level, which is reducing the acidity, so that the sperm have a more optimum environment to be able to travel through and survive. So the average man produces 1 to 2 teaspoons of fluid during each ejaculation, containing hundreds of millions of sperm cells. And this can change and it varies depending on who you are, what your average sperm count is, as well as the amount of fluid that can go. But we see about 1 to 2 teaspoons of fluid. And differences that can be maintained in this is like length of time since you last ejaculated, the amount of time in which you are taking to ejaculate. So let's say if you are masturbating and you're masturbating really quick, you're generally going to have a little bit less semen than if you're masturbating over a longer period of time. That tends to build up more of that semen, seminal fluid, as well as possibly the release of increased amount of sperm. So kind of looking at the human anatomy altogether and looking at it. So we have the testes, which is the area where we create the sperm inside the semi-inferior tubules, which then will get carried to the epididymis, which is where they will actually mature until they are ready to be released. Once they are ready to be released, that's when they're going to travel up the vas deferens to the ejaculatory duct. The ejaculatory duct is kind of where we have the Copper's glands and the prostate gland all meeting here together, which is where that combination of that semen, that sperm, is everything happening. What we know is the true ejaculate that comes out of a man is that combination of semen as well as some alkali chemicals as well as that sperm from the vas deferens that then gets released into the urethra and allowed to go through the urethra and ejaculate out of the body. So talking a little bit about the psychology of human sexual anatomy, the penis size is usually one of the biggest men's genital concerns, right? When it comes to thinking about our genitals, a big thing that we have internalized is the idea that a bigger penis is better. And research hasn't always shown this the case. So we see that 35% of gay men and 45% of heterosexual men wish they were a different size. And generally that is increasing their size of their penis, either in length or in girth, which is the circumference, so the width of a penis. Be warned that when it comes to any type of penile enhancement, whether it's a surgery, whether it's a natural supplement, none of these are guaranteed to work, and none have gone through rigorous testing by researchers. So people are really trying to test, is there effect, is it really effective, versus those trying to make money off of a product preying on people's insecurities and anxieties around human anatomy. Men with larger penises generally have better body images. However, larger penises are not necessarily preferred by female partners in heterosexual relationships. That even being said, though, if you look at the research that we've done, 5.2 inches to 6 inches being the average, just even knowing that can help a lot of people in this idea of, do I need to be bigger? Do I not need to be bigger? How do I compare to others? And kind of reduce that. What we see is we generally see men are more concerned about larger penis size than their female counterparts, though there's always the caveat of there are some women out there, just like there are some gay men out there, who really have a preference for or an arousal for and a desire for a larger penis. So there is those individual differences, but on average we really see that most people are not upset with their partner's penis and they actually enjoy the size shape of it. Which I would take as a good sign that we are connecting with each other and not necessarily on the bits and parts that we have as people. But this is a major concern for men. It also can create some anxiety when growing up and like going locker rooms in middle school and that puberty period on like, is it going to develop? When's it going to develop? The different ages of puberty can really be a big psychological factor for some men. Some men are also concerned about the size of their scrotum. I have more personally seen in my life people being more concerned about the balance between their penis and scrotum and having, in a sense, a nice overall package versus having a really nice penis or having a nice scrotum and balls or testes. But there are some people who are really sensitive about the size of their scrotum. So some men will receive sexual pleasure from increasing their scrotum size, which is really a scrotal infusion where you're taking a saline water and injecting it into the scrotum, and you're basically injecting it into the sac of the scrotum around the testes. What this will do is it will actually fill up the scrotum and create a larger appearance. And after usually 3 to 5 days or so, the water will get reabsorbed in the body, and you'll have to redo the procedure to maintain that. What we can see is we can see some stretching effect happen due to this over time, but it's still one of those things that is kind of dangerous because it's very easy to go from trying to get inside the scrotum, the cavity of it, and possibly hitting one of the vas deferens or a testes or epididymis or one of those other parts that are in there, and then you can cause real serious damage to your reproductive tract or the human sexual tract in that kind of a way. Cross-culturally, we also have genital concerns and the various genital concerns that come into play. What we see is one of them is DAT, which is the fear of loss of semen, and this is found among men on the Indian subcontinent, in which they believe their seminal fluid is a part of them and what makes them manly and masculine and human, and the loss of seminal fluid, semen, is seen as a reduction in them in their life, their vitality, their force. So masturbation is not necessarily encouraged in this community because, again, that's going to create a loss of semen, which is a fear that they do have. Another one is koro, which is the fear of penis is retracting into the body. And this is kind of found among men in Southeast Asia. One sign that has commonly talked about is men will be preoccupied with holding on to or grabbing their penis as a way to stop it from retracting inside the body. It causes a lot of distress because of losing that penis and losing that identity and what does it mean is very distressing in these cultures to these people suffering from these disorders. So these might sound very weird to us, but in these cultures, these are mainstay functional parts of their culture, and it really exists and really does cause distress if they end up falling into one of these categories. When we talk about males' genital health issues, this is kind of brought up as one of the reasons why we should circumcise men in our country is because of the cleanliness. And the idea is if you don't have a foreskin, you don't have to remember to pull back the foreskin, clean under it, dry under it well so that everything will be okay. So it's kind of the idea of let's just skip the step and make it easier to clean, easier to take care of, and then we don't ever have any worries. One thing that happens for those who do have foreskin is you can possibly get the buildup of what we call schmegma, which is a buildup of dead skin cells on body oils that ends up being into this like cheese-like substance that usually has a fairly bad odor to it that can create issues and also just discomfort within your own sexual organs and sexual anatomy. So that's something to be aware of, and that's one reason why people say we should circumcise. The other idea is that there are some sexually transmitted illnesses, and we'll discuss this later on, that they're believed to have an increased chance of infecting you through the foreskin because of the cells that make up the foreskin are more permeable to those type of microbial agents. And so the idea is if we remove the foreskin, we can reduce some STIs, but that hasn't always been the case necessarily. We haven't necessarily seen that shown through research as heavily as the proponents of that theory or that idea would want. Another thing you need to make sure you do is you do self-exams. And I am going to put this straight out there. A self-exam is not masturbation. I bet there are quite a few guys out there who'd maybe watching this and be like, self-exam, yeah, I see my penis all the time. Well, I'm going to encourage you to do a self-examination of your penis to explore your penis, but not for the purpose of masturbation. Many men masturbate. Many men think they know their penis, but that's really not the same thing as a self-exam where you're truly looking at your own penis, your own scrotum, the size, the shape, the color, the differences that you can see. And then doing this on a regular basis can help reveal STIs and cancers. If your testes have always been very smooth and very round, and then all of a sudden you're feeling them one day during one of your self-exams and you notice a lump, a hard lump somewhere, that is something that can give you an idea for concern. But you wouldn't know that that hard lump wasn't supposed to be there unless you felt your testes before. So just like we talked to women about doing breast exams, and in Colorado we used to call it the Buddy Check 9 on 9 News. They'd come on the 9th day of the month and say, hey, Buddy Check 9, everyone get their buddy and check your breasts. I say the same idea happens for men. You need a buddy check 9. The 9th day of every month, spend some time getting to know your penis in a different way that is not masturbation, but just literally exploring and looking and getting to know. This will help you understand the differences. If you end up getting an STI or cancer, it can help you identify it earlier, which then also increases the chances of being successful in treating and or getting rid of the illness or the cancer. What we can also see with male sexual anatomy and male sexual issues is erections can be fractured. So though a common slang name for a penis is a boner, there is not a bone in the male human sexual anatomy. But because of those caverns filling up with blood, you can actually cause breaks or tears or changes in those vesicles, which then can result in something like this, where we have an extreme bend in our penis because this area is not able to fill up with as much blood to balance out the erection. And so this can actually happen for a variety of different ways. One idea that is if you were trying to have forceful sex and you miss the target. So if you are trying to be a little bit more forceful or a little bit more aggressive in nature and you actually don't hit the target, such as an anus, a vagina, a mouth, that can actually cause this because you end up hitting and bending, which then causes kind of a bending break. Other times it's been known to happen such as like when the partner is on top and the man is on bottom, or the one who is giving sexual pleasure in that sense is on bottom, and whoever is on top creates, again, this type of bend because of the changes in shape during sex of the penis, and again can create this fractured penis, which they have to go in and sometimes do surgery to be able to fix. This can also happen with sex toys. And household appliances or foods. So men have found very unique ways to be able to masturbate, to be able to get off in a sense. So there have been many stories of men putting their penis inside of a vacuum and all of a sudden no longer having part of their penis because it was basically sucked off. The other idea is like men have done things with food or used food as masturbatory toys, and that can create some issues because it's a harder substance than what penis is typically used against, and can create some issues. So that idea of sex toys, whether they're store-bought or homemade, make sure you're careful with them and the use of them because this is a real big problem that can happen for people. That is actually the end of the male sexual anatomy lecture. I hope you guys had a lot of fun. I enjoyed actually putting this lecture together for you guys. It was kind of fun to be able to pick out pictures and to discuss it. I really do hope this helps you guys going forward and talking about this a little bit more and maybe being a little bit more comfortable with it. But yeah, I will see you in the next one when we talk about female sexual anatomy. Thank you.